A technique that's just catching on in America promises to melt fat away.
It is called mesotherapy, and while some people swear by it, many doctors aren't so sure. Stacey Sager has the story.
Okay, what I'm doing right now is I'm injecting a combination of medications that melt the fat under the skin.
And believers say it works wonders. In fact, Christine Comba says she's now lost 25 pounds of fat.
My bra size went down. I was wearing a 14. I'm now wearing a 10 in a jean.
Dr. Marion Shapiro is a former ER doctor who now performs this procedure in West Orange, New Jersey. It's known as mesotherapy, and it's for patients who want to lose weight or just sculpt their bodies. It's called mesotherapy because it involves the injections of 4 to 7 different compounds into the mesoderm layer of the skin.
What happens is when you inject the medication beneath the skin, it melts the fat and helps it dissolve and be excreted by the body.
Dr. Shapiro tells us she trained for the procedure in France, where this has been done since 1952, but it has never caught on here in the States. In fact, only a handful of doctors are doing it, and some of the most well-known plastic surgeons in the city strongly caution patients about it because no U.S. studies on mesotherapy even exist.
Don't do it. Wait till the homework is done. It may turn out to be something okay, but certainly not now.
And you wouldn't feel comfortable doing it now?
I would not do it now.
But patients continue to rave. They say it's much less invasive than liposuction and that mesotherapy works all over the body.
Under here, all through here, and even some in the back and the back of the arms. It's made a huge difference.
The big question is whether the fat can come back. Well, technically, yes, because the fat cells remain intact. So diet and exercise are still key. But the skeptics continue to wonder, especially about side effects and so-called off-label use, that is, medications that may be FDA approved, but not for this purpose together.
If you do have an adverse effect for off-label use, you're going against the directives of the FDA.
So you could be held liable.
You absolutely could be.
There's been no case reports of ill effects from mesotherapy, and I would assume by this time that we would know since 1952.
So Dr. Shapiro continues to believe in a treatment her patients love.
I'm doing fabulous. It's lifted my depression.
Even though the test of time in this country remains to be seen. In West Orange, I'm Stacey Sager, ABC 7 Eyewitness News.
By the way, mesotherapy is not cheap. The average number of sessions is 10, and that costs about $2,500.
Thank you for joining us for Eyewitness News.